morning, Dr. Patino here at the Cosmetic Surgery Cerritos. This is micro power assisted, meaning that this is like an electric toothbrush. You can see how the tip vibrates, and you're gonna see what happens when we start doing our liposuction here at the Cosmetic Surgery Cerritos. You're gonna be the first ones to see what comes out. Okay, so I'm not jamming the instrument back and forth. I'm just really very gently moving it, and you'll see how there's gonna be just pure yellow fat what's gonna come out. You know, this is just incredible. There's a little bit of yellow fat coming out slowly but surely. You see, a little bit of yellow fat coming out, but no bleeding. This is the important thing, that you don't see any bleeding here at the Cosmetic Surgical Center of Cerritos. This yellow fat, and guess what? This yellow fat is what's gonna go into her buttocks, right? No need to wash this fat in any way. This is what we get, and this is what we're gonna do, right? So look at this, incredible. No bleeding at all here at the Cosmetic Surgical Center of Cerritos. Look, my strokes are very, very slow, calculated, right? And so the risk of an intra-abdominal or intra-thoracic injury are much less. Why? Because I'm going slow and the instruments are controlled. And the motions are controlled, right? If there is intra-abdominal or intrathoracic organ perforation, we never had it, but when it happens, it usually happens to a very tired surgeon, maybe on a Friday afternoon, Friday night. Maybe a surgeon that's already tired after doing many cases. See, we just do 1 or 2 cases per day, but if you're doing 10 cases in a day, you're already tired from the entire week of doing many cases per day, and you want to go home and you're rushing it, right? Then it's like driving a vehicle at full speed, maybe when you're tired, maybe at night, right? Hungry and sleepy, right? And you're just going at it at full speed. Yeah, you know, your car may just, you may lose control of the vehicle, go to an unintended area. And the surgeon also loses situational awareness. That's what happens. They lose situational awareness and they go to an unintended area. Thank you. And so now I'm switching to my non-dominant hand, and I encourage surgeons to do so, even if you're not ambidextrous, because it will force you to go slow. And it's also great for the patient, because when you go slow, the risk of intra-abdominal or intrathoracic organ perforation, something that has never happened to me, is much less if you go slow, right? So using your non-dominant hand is going to force you to go slow, right? But it's also good for the surgeon. Why? Because, you know, it limits the risk of occupational injury to the surgeon in the form of tendinitis to the elbow, shoulder, or even the wrist. Thank you. Technique is near zero, really, and we never had any problem with that, thanks to God. But look at the quality of that fat. What do you see there, Emily?
I only see yellow fat.
Yellow, bloodless, oilless, fat aspirated, right?
Yes.
And this has not been treated in any way whatsoever.
Correct.
And this is what's going to go into her bottle. Yellow, beautiful fat, without treating it in any way whatsoever. We don't have any commercially available systems to clean the oil and to clean the excess blood. Incredible. Thank you. Emily, what do you think about that output?
It looks fantastic, Dr. Patino.
Go ahead and give it a close look, man. That fat graft is incredible. This is, I was telling the patient today, you know what? In the movie, you will see whatever we take out is what we're gonna put in. And so this fat graft is gonna go into her buttocks, unstained from blood and without any oil. And that, of course, is going to make her fat graft retention a lot better. She's going to be able to keep all these fat because it's pure fat. It doesn't have to be processed in any way. And we don't do that. We don't process the fat we get is what we're gonna put in there. And this is just a bloodless, oilless aspirate. Much less risk, not only of the patient not retaining, because normally when you do a fat graft to the buttocks, you lose maybe 25 to 50% of the fat. That's why a lot of surgeons put twice as much, right? Because they count on some of this fat being lost, right? The fat graft. And the fat graft is lost for a variety of reasons. See, one is that basically you're not putting pure fat, right? You're putting fat mixed with blood, mixed with oil, right? And so obviously there's going to be fat graft reabsorption because of that. And the other one is that the fat cells may die if they are collected aggressively. So we do a variety of things to be very gentle with aspiration. Look at my motion, so gentle. So I go very, very slow. And also the cannulas. The cannulas are tiny cannulas, and so they're blunt cannulas, they're atraumatic. So we go slower, but we preserve all your. Patient is on her side. We did as much as we could with the back side. You know, she needs the front done too. I recommended a tummy tuck on her, but we did the back side and fat transfer to the buttocks. And what I'm going to show you is called the pinch test, right? So look at this, see? No, we're down to 0.5 centimeters. No, anywhere we go, see? This is their waist area. So no, but of course the waist is the front and the back. We're just doing the back side. So the waist will be a lot better once we do the front side also. But what I'm doing is I'm showing you, maybe we can go from this side too, how this is the pinch test. This is part of the surgery, but you can see how there is really no significant excess fat here. It's all very regular, see? Mm-hmm. Very regular, very nice, see? You can probably see better this way, right? So we're about 0.5 centimeters here. It's incredible, thank you. The patient is on the other side, and as you can tell, we're just doing half of her waist. The other half is in the front, so obviously, you know, she needs to do the front in order to have a nice waist, but we're doing what we can from the back side, which is what she wants me to do. But in the front, she probably needs a tummy tuck, is what I recommended. But I'm using my non-dominant hand. This is incredible. See, I go so slow. And you know, I use my non-dominant hand 50% of the time, my dominant hand 50% of the time. That way, I'm rested also, right? And so minimize the risk of occupational injury. And look how comfortable I am, you know, so I go slow, I'm not sweating it, right? So it's good for the patient because by going slow, you're going to limit the risk of intra-abdominal or intrathoracic perforation, something that has never happened to me, thanks to God.
Hey doctor,
yes.
Is this the fat going in the patient's buttocks?
You bet. This
oh
is
my.
the fat graft that we obtain, and this is the fat graft that's going to go into our buttocks, yeah.
It is glowing.
Yeah, it is beautiful, yeah. As usual, right?
Right. So talk to me about the traditional ways.
Well, with the traditional way of doing this, there is significant amount of bleeding. So you can tell because what goes in to the buttocks is red or pink, right? Even though usually that's after they have processed that fat with commercially available processing systems that clean the excess blood and excess fat. And we don't use them. Why? Because look at this right here by the cannula, right here.
Yeah.
It's the most pure fat ever. So that doesn't need to be processed in any way. And that pure fat like this, 100% fat is what's going to go into her buttocks. So what happens is that if you put blood in there or oil, the blood doesn't belong there. The blood belongs inside the blood vessels. And if you put blood in there, the body's going to reject it. They're going to reject that blood, and they can have complications like blowout fractures and oil cysts. If you put oil in there, obviously the body's going to reject it. It's going to create a cyst, very much similar to foreign body reaction, where you basically have a piece of glass and the body forms a callus around it and pushes it out. The same thing happens. In addition to losing the fat graft, 30 to 50% of the fat graft is lost because it's not real fat, it's fat and blood. So obviously the blood is going to get reabsorbed or rejected by the body, right? And the oil, the same thing, it's going to happen. So that's incredible the way we do this in a completely bloodless. So look at the nice waist, and this is just the back side, you guys. She still needs to do the front, but we're just doing the back side. But look at this, see, this is 0.5 centimeter. This is the pinch test right on the waist. Beautiful, look at that, see? 0.5 centimeter over here, see? Everywhere we go, look at that. Can you see it? See, you can probably do it this way too, see? Like this, see? Like this.
Wow.
Either way, see, it's better this way. Maybe you can see how the 0.5 centimeters everywhere you go. It's just unbelievable. Look at that. Thank you very much. Wow, so look at the high definition here. This is very nice here. And the paravertebral lights, when she stands up, is gonna be like this, see? Very nice. Thank you. Wow, so look at this. Didn't I tell you, you guys, that the fat, the way we obtain it, is the way it's gonna go, right? So this is pure yellow fat graft. This is how we obtain it. This is how we did the liposuction, without any blood, without any oil, not even a speck of blood in there. And we're doing it under ultrasound guidance according to the World Association of Gluteal Surgeons guidelines. We're putting the fat graft in the deep subcutaneous space, and I'm looking at what's going in, I'm looking at the patient, and I'm looking at the ultrasound, and we put 100 ml already, and so at 100 we move to the other side, and we put 100 here, 100 here, 100 here, 100 there, like that. So we keep moving, so the quality of the fat graft is about the same on both sides, and she's not gonna have one cheek bigger than the other. We just go here, and maybe there is more fat on this side than the other, who knows. But that's why we do it. 100 here, 100 there, and I move to the other side. We'll show you. Thank you. Righty, so we're doing the left buttock, right? We're going in the deep subcutaneous space. We're doing it under ultrasound guidance according to the World Association of Gluteal Surgeons. This is just amazing. But look at that fat graft, completely bloodless, completely oilless. And we're doing this very safely. This is the way to do it. There's a small space. We're going to show you how it is. Thank you.
All right, so now we're showing you the ultrasound image right here. You can see this bright line is Dr. Patino's cannula.
I'm going to wiggle it for you, see?
And he is in the safe zone, which is the subcutaneous space. Up here, this portion here is the skin. And then here is the superficial gluteal fascia. Below, down here, is the deep gluteal fascia. And then below that is the striated muscle here. So that's the unsafe zone. We don't want to go there.
But look how narrow that is. That is almost like, how many centimeters is it? Not even 1 centimeter?
Yeah, maybe one.
Wow.
Very
So
little.
this is incredible because this procedure is usually done blindly and you can easily miss it. And you see how narrow that space is?
Yes.
Now tell me what's going to happen right now.
So as Dr. Patino enters the fat in this space,
The deep subcutaneous space.
yes, with his cannula, it's gonna move. It's gonna make it bigger. So it's gonna move the muscles down, and it's gonna enter in there, making it.
So you're going to have a gray cloud. That's the fat graft. 1, 2, 3, and you'll see what's going to happen.
So here is the gray cloud forming as he enters in the space, and it's pushing the muscles down, and the subcutaneous space is getting bigger.
Awesome. Thank you. Wow, so you see how much bigger that space is?
Yes.
But if you do it blindly, it's very dangerous because if we go into the muscle by mistake, we can perforate the superior or inferior gluteal veins, and these veins are mighty close to the big circulation, to the inferior vena cava, and the fat graft literally gets sucked in there, and the patient has a massive macropulmonary embolism and dies usually within 24 hours. That's why I am the CEO of the World Association of Gluteal Surgeons. We're saving lives throughout the world. by teaching doctors to do this under ultrasound guidance. You can see beautifully here that we are in the correct space, right? So let's watch it again. Looks my cannula right there. And 1, 2, 3, the fat graft is being injected as I control the cannula. And now we're making the space bigger. You see? Incredible. Thank you. Wow, look at this patient, man. She looks incredible. No bleeding, just beautiful buttock, nice projection, beautiful high definition of the and sculpt. Very nicely sculpted back. Look how it comes down here. Look at the buttocks and wow, it is incredible. Thank you very much for watching.